this, and this is actually interesting stuff. Acquired immunity, right? Now, when we went through this antibody production, again, right, know this chart. You might see something like this on the test. So when we talk about antibody production, the primary secondary response, there's a reason why we vaccinate. And sometimes we'll have multiple vaccination points. With HPV, it's not just one vaccination, you gotta go back, right, and get a second, right, vaccination. Especially as well with, right, when we're talking about hepatitis as well. So those are all multiple injections, right? Why? So then we can have increased amount of memory cells that are saved. With each introduction of a vaccine, we save up more memory cells, right? Now there comes a point where, yeah, you're not gonna make more. So you might not need 5, 6 hepatitis, right, B and C, vaccinations. After 3, that's enough. We'll save up enough memory cells that if we get exposed to hepatitis, we will have enough memory cells that will just explode in number, make enough antibodies, so then we don't even get ill. Now, acquired immunity, what is this? There's 4 main forms, 2 active and 2 passive forms of immunity. The active form of immunity produces memory cells. So then it will give you a pretty long protection phase. So there's active natural, active artificial. In both instances, the active means that you are going to actively produce memory cells. So active natural is natural exposure to the antigen, and you have a natural infection with the live version of the virus. Now, if you get the best example, varicella zoster, chickenpox virus, right? If you get the real chickenpox virus, you will be, it usually doesn't cause, the younger you are, the better, because number 1, you're able to cope with it better. Number 2, you're not going to remember it, right? Because you were young. So the older you are when you get chickenpox, the worse it becomes. Your body's immune response is actually a little bit lessened, and you might have some really bad, conditions that kind of is seen from this. So you might get infections from all the rashes that you scratch at. Now, one of the things that we don't remember, because so many of you guys have the vaccine and don't have the actual illness anymore, is that you will see blisters sometimes, especially in older people who've never had it. They'll see blisters and poxes in the mouth and the throat. It can occur anywhere where you have stratified squamous epithelium. Now, in active natural immunity, you actually are somehow exposed to the real life virus, right? In the process of clearing that virus, you're going to produce memory cells that you save up for the rest of your life. 10, 15 years later, your son might come home and might have been exposed to the chickenpox virus. By the way, if they're exposed to the chickenpox virus, even though they've had immunization, a vaccine for it, they might still have a few marks that you can see on them. That happened to my son when he was in grade school. What happened was we saw just a few marks on his arm and legs. And we wondered, like, what is this, right? And right away, I was like, well, it can't be chickenpox, can it? Because there was just only a few of them, and he had been immunized before. It was chickenpox. Now, for him, he was fine. But he would be a carrier for it at that point. He could give it to somebody else. So we had to keep him home because he actually had that chickenpox virus in his system. And if he goes to school, and then they have somebody that's immunocompromised, a teacher or another child, right? He can pass it on to that child. So we kept him home to make sure he doesn't spread that illness to other kids. So that does happen from time to time. You still have some mild form of it, especially if you have the active artificial immunity. That's vaccination. Now, in active artificial immunity, we're artificially introducing either a dead form of the virus or the viral capsid, right? The capsule with all the actual epitopes. Because it has all the epitopes, we activate the immune system the same way. The difference is, unlike a live virus, there's no DNA, there's no RNA inside. So there's no genetic code inside that virus. So it's like an empty shell, and that's it. But your white blood cells don't know that. Your white blood cells only recognizes those epitopes. And those epitopes that are sticking out of the capsid are similar and sometimes identical to what we see in a natural virus. So you start forming memory cells as a response to it. Now, again, it doesn't have any genetic material, so you shouldn't get an infection at all. So how come some people get sick after vaccinations? Some people get flu-like symptoms after vaccinations. Sometimes you're like me and you get really bad flu-like symptoms after vaccinations. The reason why is simple. It's your own immune system causing it. There's a reason why when you hear of all these really bad illnesses, right, dengue fever, Ebola, right, and even HIV, swine flu. You guys know how many people died of swine flu in 2009? All right, really, right? We're talking about hundreds of thousands of people died of swine flu globally, right? That's, you know, pretty bad, right? 100,000 people, we believe, died of swine flu in 2009. That is what is more scary than even this. Yes. So what we're going to see, though, is that when we see that all of these, you know, conditions, I mean, what is the scariest kind of virus we see? Ebola, right? Is anything scarier than having blood coming out of your orifice, right, uncontrolled like we see in Ebola? Usually not. That's pretty damn scary. So even, you know, you don't want to catch it. It's got a high mortality rate. It starts out the same, flu-like symptoms, right? Why? It's not because it's an actual virus itself or bacterium that causes it. It's your immune response to the virus and bacterium that's giving you the flu-like symptoms. So when you get a response to a vaccination, it is your own body's immune response to that dead version, right, attenuated version of that virus. Now the good news is you will form antibodies, you will form memory cells that are saved up for future infections. Artificial, passive, or passive natural. So whenever you hear the word passive, think of some transient response. Transient means short time frame, right? It's there and then it goes away. So you do not form memory cells. You have a transient response to this. There's only 2 times when we see these. Now, especially with passive natural immunity, there's only 1 time we see this, right? And that's when we are babies. Passive natural immunity is a transfer of antibody, usually IgD and IgA, right? Antibody G and A from mom to baby. Usually it's transferred by breastfeeding. What happens? Your mom just transfers an antibody. The antibody provides baby with the same protection as mom would get from the antibody. This is why, in terms of, right, you have heard just from TV shows and everything else, that doctors will say, do not call me if you have a cold unless the fever is over 101 degrees. That's true unless you're under the age of 6 months. If you're an infant that's breastfeeding, all right, and you're under the age of 6 months, any fever, any at all, if you get a fever that's at 99.5, any fever is bad, right? So not only is it bad, any fever at that point means you have to go to children's, means you have to get an automatic lumbar puncture, right? A spinal tap. The reason why is because you should have passive natural immunity from mom. And that passive natural immunity under 6 months of age should prevent most of these illnesses. And if you're still getting sick and you're getting a fever as a result of it, there's a big chance that it might be strep B caused meningitis, right? So, I mean, they don't play. I remember when I was in medical school, my daughter, right, when I was a 4th year, my daughter was about 3-4 months old, and she felt warm, right? And take a temperature, 99.8, close to 100. And I was like, oh crap, right? Because in my head, I'm like, that's an automatic lumbar puncture. I knew it right away. And I also knew that the reason why they do an automatic lumbar puncture was because they're worried about meningitis. So what do? I do a couple exams on her, right? She's an infant, turn off all the lights, and then I shine a light in her eye. One of the things that happens with meningitis is that they have a photophobia, an absolute overpronouncement with just a little bit of introduction of light, right? Now, there's nothing more, I mean, I turned off all the light and then did it, so I can want to really see if there's any kind of photophobia. Nothing. Then I check some of the reflexes that you'd see with meningitis, right? One of the reflexes is you just kind of move the head up, and if you have meningitis, movement of the head, right, anteriorly will cause your knee to kind of move. All right, check that, no response. So I checked her lungs, checked everything else, and I didn't take her in because I knew it would be an automatic lumbar puncture, and the chances of her having meningitis, I would imagine, was less than 0.1%, right? And then my wife took her to the doctor a month later for a checkup, and she asked, how's she been? And of course my wife goes, oh, she had a fever the other day. And the pediatrician looks at me, right? Immediately looks at me. She goes, you know that's an automatic lumbar puncture, right? I'm like, yes, I know. Right? I know it's an automatic lumbar puncture. But I just swear to God, I did every single test every 3 hours to make sure that it wasn't meningitis. But that's the only time when when we are worried when you have a mild fever is when you're under the age of 6 months. Now, what else? This last one is pretty cool. Passive artificial immunity. Transfer of antibodies or cells from immune animal to a non-immune one. Usually the non-immune one is us. I don't know why they word it this way, right? So what happens, right? An example of this is rabies. Another example that you guys have all heard about, antitoxin, antivenom, right? You guys have heard that antivenom, the venom itself, costs more than gold, right? Why does it cost so much to produce? The reason why is it's really hard to produce, right? So in order to get antivenom, let's say I have a king cobra. In order to get antivenom, I'd have to milk the king cobra. Once I milk the king cobra, which is dangerous as hell, right, I have the venom. Then I introduce that venom into an animal. Yeah, I know, it sounds terrible, right? Usually the animal is very strong, much stronger immune system than us, horses, right? Horses have been running around the plains for millions of years. So they have to be used to, rattlesnakes and poisonous snakes. So their immune system is able to clear that toxin, that venom, much easier than us. So once we introduce that king cobra venom into the horse survives, they form antibodies to the venom. The antibodies to the venom then attaches to the venom, making sure that the venom doesn't cause damage to their body. So then they don't get sick from the venom. Then a couple weeks later, we are going to remove some of the blood from that horse and then filter and remove that antibody for that venom. Anti-venom. Antibody to that venom. Yes?
How many, how many doses can you get from a horse?
Right, a lot, all right? So you're gonna get a lot of doses. The problem with the doses is that these are proteins. And our body, and a lot of times we see this with people that have had multiple injections, right? They start forming immune response to the antivenom. So some people have allergies to it, anaphylactic allergies to it, right? So what happens then is this, right? Now I make antibodies to the king cobra venom, but it's specific to the king cobra venom, right? What happens if you get bitten by the eastern diamondback rattlesnake, right? Well, what happens is that's a completely different venom with different epitopes, right? The king cobra antivenom might not do anything to help resolve a bite from another poisonous snake. That's why it costs so much. Now, same thing with tetanus and with rabies, right? You guys have heard about if you're exposed to rabies, right? And I know there's this kind of crazy thinking or like a crazy idea that you need like so many shots into the abdomen and the needle's real long. Yes, you might need some shots into the abdomen, but the needle's very, very, very small, right? right? It's not an intramuscular shot. You guys have all had tetanus shots, right? That goes into the muscle. And no matter how tough you are, it kind of hurts for the next couple of days, almost a week. That's not the kind of shot we do with rabies. Rabies, we do subcutaneous, a very small needle. All we want to do is introduce, right, antibodies to the rabies toxin. As we have the antibodies then attaches to the rabies virus and toxin, right? And what happens? Well, it clears it, so then the rabies doesn't affect your brain. You guys have heard, I think we talked about rabies last semester, right? That there's, until 2000, there's never been a recorded case of a human surviving rabies once they have had, right, the symptoms. Once they've had symptoms, until 2000, nobody survived, right? Until 2000 with Gina Giese at Medical College in Freiburg. And what they did, high levels of very strong anti-inflammatories, give her some antivirals, right, to hopefully kill any of the, rabies viruses that's left over, and they put her in a medically induced coma. And if you believe in God, they pray like hell, right? So somehow she survived, right? When she survived though, she had to learn how to talk again. She had to learn how to move her legs so then she can walk. She had to learn how to feed herself. In other words, it didn't come at like no cost, right? It caused damage still, even though she survived. Eventually she was able to, do all those things, all right? She got married and she got like babies now. I don't know why it's right? So she's normal, right? She was able to have a normal life, right? She was able to have a normal life. The crazy thing is they did that same regimen 4 other times to PPs, right? To people that have shown symptoms. All 4 of those people died, right? And then the 5th one, they're able to just titrate it a little bit differently, and then now we see like 3, 4 of them that survive. It's still handfuls of people that survive once they've shown symptoms. So my saying to you is, if you are everywhere, anytime you're near a bat, don't be near a bat, especially not in the wild, number 1. Right? If you're near a bat, don't get close to one, and if you are, you assume you've been bitten, right? And you got to go in there, and then the Department of Public Health will make sure that hopefully they'll catch the bat, see if they have rabies. If they can't catch the bat, there's an expectation that the bat had rabies, so you better be ready for some shots, right? The shots are very small, and it's antibodies to the rabies and its toxin. Right. Now again, with these right here, right, we're giving you antibodies. It's only good for that instance, and that's it. You're not making any memory cells here, right? It's only good for that specific time that you're receiving the antibodies. Last thing we're going to talk about is hypersensitivity reactions, and then we'll go. Right? Hypersensitivity reactions, again, aging of the immune system, it sucks. Right? Hypersensitivity reactions, right? There's 4 main types. Type 1, antibody-mediated. Type 2, different antibodies. Type 3, other different antibodies. Right? And then the last type, cell-mediated. Now, let's talk about these types. Right? So type 1 is acute and is mediated by IgE, antibody E. This is your classic anaphylactic shock, right? What happens with this? Remember, a hypersensitivity reaction is a reaction to something that most of us don't have a reaction to. But for some reason, you've been exposed to it, and now you have a disproportionate response, right? Now, example, peanuts. I mean, what does peanuts do, right? It shouldn't cause any reaction, but yet we know it does. So peanut allergies are just exploding in number. It's really crazy. But it's only exploding in number in developed nations, in America, right? In really clean, sterile nations, right? Now, one of the things is Israel is a developed nation, but it's not so clean, right? So what we see in those areas that is not as sterile is that they have less probability of kids with type 1 anaphylactic allergies. We don't know why, right? We think it's because the immune system gets kind of bored and it starts to attack things that are not going to be dangerous and starts treating it like it's dangerous. So in type 1 anaphylactic reaction, most common of the 4 hypersensitivity reactions occurs a few minutes after a person sensitized to an allergy, to an allergen, is re-exposed to it. In other words, you need to be sensitized. You need to have an exposure, and after that exposure, you have some mild response. The weird thing is this: there are people that have been eating seafood just about their whole life, and for some reason, they eat it that one last time, and they start feeling weird, right? They start feeling like their neck and their throat starts to close off. And at that point, they're sensitized to it. If they would eat seafood one more time, they will have a full-out anaphylactic reaction. So at that point, you need to stop eating seafood, right? Because you will develop an anaphylactic reaction. Now, what happens in a full-out anaphylactic reaction is IgE antibodies found on the surface of mast cells and basophils causes systemic release of histamine. When you have systemic release of histamine, it's almost always bad. Now, when you have a local release of histamine, like an inflammation in one area, usually it's good, right? Local is good. Systemic release causes widespread vasodilation. So much so that what happens if you vasodilate almost all of your arterioles? Well, what happens is they're bigger, and now you can't create blood pressure. And if you can't create blood pressure, blood doesn't move. All right? So you have hypostatic right here, hypostasis, right? Hypotension. Now, the worst part is this. It's not just you have low blood pressure, right? Hypotension and then shock, right? The other bad thing is the opposite occurs in the smooth muscle of your lungs. In the smooth muscle of the lungs, histamine causes the bronchioles to constrict. Remember when I mentioned a few minutes ago that your tertiary bronchi, all cartilage. But when we go into the bronchioles are all made out of smooth muscle. So they can constrict and dilate. When you have histamine released into the lung, they start to constrict the smooth muscles in your bronchioles. So now you have the worst combination. You can't get air in, you can't get blood moving, right? That's pretty bad. Either one of them by itself is going to cause you to die. So what do? We give you epinephrine, an EpiPen. The EpiPen is going to increase your blood pressure. At the same time, epinephrine going into your lungs bronchodilates. Right? So increased blood pressure and bronchodilates, treating both symptoms. Albuterol is a type of beta adrenergic similar to epinephrine. The big difference is albuterol only stays in the lungs. Right? Now, if you take a lot of it, I've seen people that, almost religiously pumps, have like 3-4 puffs every few hours. If you're doing it that many times, there's a great likelihood that the albuterol actually goes systemic. So you will see slightly higher blood pressure as a result, right? But the reason why, in a pinch, if all you have is an EpiPen and you have an asthma attack, you can give yourself a shot of epinephrine, right? And that should bronchodilate you, so then you can get air in. The bad news is EpiPens are pretty damn expensive, right? So I heard that they're really expensive now, so it's much more beneficial to be carrying an inhaler then. Yeah. Right. Type 2 reactions. So type 2 reactions are cytotoxic reactions where antibodies start attacking your body's own cells. So here is IgG or IgM. Basically antibodies directed against a person's either blood cells or tissue cells. So an example of this are your blood transfusion reactions, ABO reactions, right? That's a type of type 2 hypersensitivity reaction, right? Now, this type of hypersensitivity reaction, again, usually doesn't happen to most of us. Hopefully most of us don't need blood, right, transfusion, and they don't give us a wrong blood transfusion, right? And what happens is the second kind of disease we see that's type 2 is something called good pastures disease. Those are two situations I just want you to know. Good pastures, in good pastures, we start attacking our body's own lungs and kidneys. All right, and here's what it looks like. This looks like a lung, doesn't it? It's swollen, it's large, it's blackened. This is a kidney, right, that's been attacked by autoantibodies, and now it looks all scarred up and dead, right? That's what happens with people with good pastures. It's pretty bad, right? Type 3, best example of type 3, something you guys have all heard of, lupus. Systemic lupus erythematosus, right? Now, with all of these, right, type 2, like the good pastures, type 3 with lupus, it primarily affects women. Most autoimmune system diseases usually affect women, right? Hate to break it to you, right? It sucks. It's not fair, right? But it does affect mostly women. Type 3, basically what happens is that you have an antigen, right? You have some kind of things that most people don't think is an antigen. So in most people, you don't even have a response. But in people that have lupus, right, you have some kind of protein that the body treats as an antigen. Then antibodies starts attacking it and attaching itself to it. As an antibody starts attaching it, more antibodies starts attaching, right? And now you have this big cluster of antibodies and antigens that's floating around your body. As it floats around the body, it forms clots. And the clots we see, right, as little rashes, and it can happen anywhere. Right? These immune complexes, these clusters of antibody and antigen can be deposited anywhere you have blood vessels. So I used to think that lupus, I have friends with lupus, they're able to have kids, they're fine, right? Until I had a patient with lupus, and she was mentally not there. She was a 12-year-old daughter of 2 doctors, right? And she didn't even know her name. Why? Was because she had a lot of those immune complexes that deposited in the brain, all right? And she had multiple strokes as a result. Now, one of the things that we do see with lupus is this, and it's a telltale sign of lupus. This rash. We call it the Maller butterfly rash. Take a look. How many women do you see? I know, right? This one, I think that's a lady, though. All right? But take a look at how many girls versus how many boys. Yeah. Crazy, isn't it? Yeah. All right? So it predominantly affects women, this lupus, and it's a type 3 hypersensitivity reaction. The last one I'll talk about is type 4 hypersensitivity reaction, and is the T cell, the only one that's T cell mediated. And I lied, we were going to stay the whole time. All right, so, hypersensitivity reactions, and I'm not trying to show off my arms, I'm trying to see if it's on the side. All right, so on my arm right here, I have what's called a BCG vaccination, right? BCG vaccination is for TB, right? And what happens with it is if you're born in America, you don't have this. I was not born in America, I was born in Indonesia. I moved to America when I was 9 years old. If you're not born in America, you have it, right? You have it too, don't you? Right? And what happened with this is this. This is a vaccination supposedly for Mycobacterium tuberculose, TB. It's not very effective. That's why you don't see it in America, right? Well, what happens is you introduce that Mycobacterium, an attenuated dead version of it, when you vaccinate. And then you, in the hopes of kind of, clearing it like a vaccine, and you have memory cells as a response, right? The bad thing is it doesn't produce memory cells. So it wasn't very protective, right? The second bad news, you will permanently have positive TB skin tests as a result, all right? Every time, if you get, all right, so what happened when I was in medical school, when I was younger, all right, when I was entering medical school, TB skin test became positive, right, it got big, and I had to do like chest x-rays, right? And I actually did the actual antibiotics. 1 year of antibiotics. They were really strong. So strong, they tell you not to drink alcohol because it affects your liver so badly, all right, the antibiotics. And they give you vitamin B12 shots, right? For me, it was like every month, just to help support the liver. Now, I forgot that I had tested so positive, and then when I was in medical school, right, my 3rd year, I had to work at, 3rd or 4th year, right, I worked at a naval, right, station, right, North Chicago Naval Station. And there, and I was at the VA, they, I mean, really tried to push me into getting it. So I'm like, all right, I'll just do it. All right, I did it, and not only did I get a really big positive, right, it looked like I had a cigar burn, right? It looked black, right? I thought I had a permanent scar. It looked so bad. It wasn't just a small permanent scar. It looked like it was like that big, right? So in the middle of summer, to prevent people from freaking out, I was wearing back then turtlenecks and, right, real long, right, sleeves, right, in the middle of summer. So then people wouldn't look at my arm because it looked so bad, right? So this is a type 4 hypersensitivity reaction, the TB skin test. If you've ever tested positive, whether it's a false positive, which ours are, right, you can never do a TB skin test again. It'll get progressively worse with each one. All right, stop right here. What's up?
They just said Tom Hanks and his wife got coronavirus.
Really?
It's on the news.
Oh.
Let me see.
Oh man. I don't know if it's a. I was like, what the hell happened? I mean, it freaked me out. I thought somebody.
Famous person